So, very good evening to one and all, and thank you everyone for joining. We can see almost 80 participants has joined. So, thank you all the late evening of the Sunday. And I am Shomendu Ghosh from Cognize Nutrition. So, on behalf of Cognize Nutrition, once again I welcomes you for a very important scientific session. And this topic is being chosen by dietitian Khusboo Singh. So along with her team, Mr. Krishna and Kajal is there to present this. So I want to say a decade before also the importance of vitamin D was not there among the people, or why this is not there we can discuss during the session, but it is one of the very important fat soluble vitamin nowadays. And if in our clinical practices, those who are clinical or consultant dietitians, they will agree with me that day by day the importance of vitamin D, how it is increasing. And even I was also not familiar with the impact of vitamin D on fertility. So this topic is also new for me. And we all know it is important for calcium absorptions, it is important for skin, it is very related to diabetes, related to obesity, related to PCOS, and many more. So I will request Pritha without any further delay to introduce our speakers. Then we will get to know the things, and after that we will have a short discussion session at the end. There will be some interesting questions at the end, so we will discuss. So I will request dietitian Pritha to introduce the speakers.
Sure, sir. So, good evening, one and all present today. Thank you for being here. So, very rightly said by sir, vitamin D is one of the important nutrient for fertility because infertility rate is quite increasing day by day, and the prevalence rate is also going very high. So, our today's speaker will definitely highlight this topic: how vitamin D influence the fertility and the rate and all. So now, without further delay, I am going to introduce our three speakers of today's session. Our first speaker is dietitian Khushboo Singh. She have done her MSc, BSc, and MSc, and also she have completed her B.Ed. She have been pursuing PhD, and also she have done the Triple L course and completed 4 modules under SPEN. She has also a professional experience of many years now. She is a consultant nutritionist in Amoy, India Private Limited. Formerly, she have been attached in Boki, and also as a community dietetic intern in Shahayata. She have also completed a dietetic internship at Medical North Bengal Clinic. She has several achievements in poster presentation competitions in national and international conferences. She have also stood as she secured first and second positions in NMN celebration, National Nutrition Month celebration. Also, she has several scientific publications. Total, she have contributed in 12 research publications or in international and national journals. Also, she is a life member of our Indian Science Congress Association and also IAPN and FST Exploration Foundation. Now, moving on to our next speaker is Mr. Krishna Sharma. He have completed his BTech in food technology. Also, he have done a PGDM course in dietetics, health, and nutrition. He has also done certified course in nutrition as well as gut microbiota. And also, he had been pursuing medical nutrition therapy in Cognize Nutrition. He have also completed 6 months internship in Global Gourmet and 3 months internship in Food Regulation and Compliance Center. He also have various achievements in and worked in food technology projects like low temperature and low cost refrigerant. He is also delegate in multiple national and international conferences. He have pursued our 6 months MNT course and a family member of our Cognize Nutrition. Our third speaker is dietitian Kajal Prasad. She have also done her BSc in Calcutta University and MSc in Food and Nutrition from IGNOU. She have also pursued her Certified Diabetes Educator course and completed our 6 months MNT course from Cognize Nutrition. Now she is working as a junior dietitian at J.N. Roy Hospitals and also completed the internship from the same. She has also been a delegate at multiple national international seminars and regularly working in community camps with schools, NGOs, government sectors, etc. So now I am going to give the presentation to our first speaker, Krishna Sharma. Krishna, it's over to you. Thank you.
Thank you, Prithaji, for such an astonishing introduction. And good evening to one and all. Myself, Krishna Vinod Sharma. And our today's topic is role of vitamin D on fertility. So let us start with the introduction. So whenever we all think about vitamin D, what does the first thing comes in our mind? Like vitamin D is an fat soluble vitamin, or it has an important role in calcium absorption, bone function. But is this all? No, I think vitamin D, unlike other vitamins, vitamin D has an multiple and vital roles in our different body functions. So let us have a look on vitamin D. So vitamin D is an fat soluble vitamin. It is also called as an sunshine vitamin, but it is also an steroidal hormone which is important for our body. So there are two types of vitamin D. One is vitamin D3, which we get from different sources like fishes, like tuna, sardine, and many other supplements, which are many other fish oil supplements, and many more. One is a very good example, which is sunlight. And the another type of vitamin is vitamin D2. It is also known as orgocalciferol, which we get from plant origin or different species of mushroom. So this two, vitamin D3 and D2, is an inactive form of vitamin D, which we get. Then our body metabolizes these vitamins in an effective manner, which in the form of calcitriol. So there is a two-step of hydroxylation. So let us have a look. So when the sunlight strikes to our skin surface, it has a UVB light. So when this UVB light strikes on our skin surface, there is an cholesterol called 7-dehydroxycholesterol. It convert into cholecalciferol. Then, with the help of blood, this cholecalciferol enters in our liver. Here, with the help of 25 hydroxylase enzyme, there is an enzymatic reaction takes place, and then this cholecalciferol converts into cholecalcidiol. Then this cholecalcidiol enters in our kidney, and here, with the help of 1 alpha hydroxylase enzyme, it converts into cholecalcitriol. So this cholecalcitriol is the most effective form of vitamin D which our body requires, and this is only that steroidal hormone which I have told you about, which I have told you previously. Now let us have a look on how what are the roles of vitamin D in our body. Next slide, please. So the very first function, as we all know, that vitamin D is very much important for our metabolization of our bones and calcium and phosphorus in our body. So with the help of homeostatic mechanism, it increases the serum absorption of calcium and phosphorus in our body. It also increases the intestinal absorption of calcium and phosphorus. Also, it at the time of remineralization, it triggers our bone for remineralization. Then next, moving moving on to the role of vitamin D in our immune system. Unlike unlike other vitamin D also has an important role in our immune system. It inhibits the immune response that are mediated by our T cells. Also, also also vitamin D modulate the innate and adaptive immune response in our body. It has been seen that people with the prolonged deficiency of vitamin D or frequent deficiency of vitamin D are showing the symptoms of autoimmune response. So there should be a proper monitoring of vitamin D should be done. Then it has also an important role in our heart function. In our heart, it keeps our blood vessels lining flexible, and also our blood vessels healthy, by which it prevent the rate of hypertension. Also, In muscle functioning, it helps to maintain the oxygen consumption rate in our muscles, and also it improves the optimizations of our muscle strength and formation. Then then in cancer, so in cancer, vitamin D affect the biological structure of our tumor cells, and it affects the behavior of our tumor cells, by which it makes them less likely to spread. Also, it has been seen that people with good or high vitamin D level are less have less severity in cancer, or the rate of severity in cancer get decreases. Also, vitamin D has an important role in our cognitive function. So in our brain, it decrease the sign and symptoms of depression and anxiety. Also, by increasing the happy hormones in our brain. So let us have a look on the very important aspect of vitamin D, which is our topic as well. So I would like to share one case study. So Denmark government has taken survey. Denmark government has conducted a survey where they have checked the vitamin D level of a certain group of people, where they have found the deficiency in vitamin D level. So for few years, Denmark government has introduced the vitamin D supplement for their population. After few years, they have reconducted the survey, and there they have found that there is an increase in 81% of fertility rate in their population. So that's all for me. Over to you, Kajal.
Thank you, Krishna. Hello. Thank you, Krishna. You have explained very well. Now we are going to discuss the reference range of vitamin D. So, if the vitamin D level is less than 20 ng per ml, then it is deficient. And less than 30 ng per ml is insufficient. Level between 30 ng per ml to 100 ng per ml is sufficient. And the level above 100 ng per ml is the toxicity of vitamin D, which is also known as hypervitaminosis D. Now, a case study shows that, which is shown by this pie chart, that vitamin D deficiency is very large in Indian population. As we can see, it is 68.50%, and the insufficiency is 16.76%. Only the 14.5% of Indian population are sufficient in the vitamin D level, and the only 2.9% of population have toxicity level. Now we are showing a graph which indicates here gender wise vitamin D deficiency in India. Here blue bar indicates the overall population of India, and orange bar indicates the male population of India, and the gray bar indicates the female population of India. Here we can see, as we can see, male population are more in vitamin D deficiency than women. Vitamin D levels significantly reduce in both men and women with, with obesity. However, compared to women, serum vitamin D was consistently lower in men irrespective of obesity and vitamin D. Sorry, and type 2 DM. Next, we are showing here another graph which shows age-wise vitamin D insufficiency in India. The age group below 30% are more deficient in vitamin D, which is 90%. And the age group between 30 to 45 are 85%, and age 45 to 60 are below 90%, and age above 60% are 80 have 75%. Next slide, please. Before so next, our topic is role of vitamin D in in fertility. Before going to that topic, we should know what is fertility and infertility and how it does impact on a couple's life. Fertility. Fertility is the ability to conceive a child. The fertility rate is the average number of children born during individual's lifetime and is quantified demographically. On the other hand, infertility is the difficulty or inability to reproduce naturally. According to a case study, 8 to 10% of couples in worldwide are suffering from the infertility problem. Uh, in the worldwide population, 25% people are only from the India. By the according to a report by the World Health Organization, one in every four couple in developing countries is affected by infertility. This problem is not a health issue only. It does impact on couples' personal life and mental health. Infertility treatment is very emotionally taxing and extremely expensive. The majority of infertility treatment costs lakh of rupees, not only rupees, but the precious time of the couples. As we know, nowadays time is very much important for everyone. So, thank you everyone for your patience listening. Next slide will be covered by Ms. Khusboo. Thank you everyone.
First of all, I would like to thank Kajal and Krishna both for starting the session on a very good note and giving a good boost to our discussion today. So, as Kajal was discussing in the previous slide, that fertility industry as a whole, I'm calling it an industry, though it is a healthcare sector, but it is a billion-dollar industry, we can say, because there is a lot of money involved when we are dealing with the fertility issues. So what is happening is that because already these couples are emotionally a little in a vulnerable situation, and these procedures, whichever is assisting them to in conceiving, actually is not successful in the first go. Generally, it will take around like multiple attempts to for it to become successful. So because of that, a lot of money is going into it. Economical perspective is there, but then emotional drainage is something that is there. So there is a need that we find something that's alternative and can assist these couples in the starting, so that they do not have to go to the assisted ways of conceiving or assisted ways of treating fertility, but we are trying to find an alternative rather. So of course, we know about the classical roles of vitamin D. They have been studied extensively, but this is a non-classical role of vitamin D, which has not been studied that much. In the last decade, there has been some light to the topic, but then still a lot is not known for us. So I'll be discussing a bit about how it is influencing and how we are coming to even that point that fertility is connected to vitamin D supplementation or maybe vitamin D deficiency. So one of the key roles in of vitamin D can be found out by the presence of vitamin D receptors on both the male and the female reproductive organs. So when I say about fertility, generally we have a notion, because physically we can see the mother being the one who is carrying the child in her womb. Somewhere or the other, fertility fatak se it gets connected with the mother or the female. But then the VDRs are also present on the male reproductive organs, not only on the primary reproductive organs, be it the ovaries and the testes. In in the females, it is the ovaries, and in males, we can see the testes. But even on the accessory organs, the vitamin D receptors are present. Now, also these VDRs are present on the hypothalamus, the hypophysis, the ovaries, the granulosa cells, the endometrium, the placenta, decidua, and in the testes as well. And in the cells of spermatogenesis, when it is happening, there also vitamin D receptors are actually present. So we can understand that in the whole process, the level of vitamin D will actually affect the fertilization process from the very start actually. And not only that, even the diseases or the issues we are facing a person is said to be infertile, in that time also vitamin D has a role. Now there is a certain gene which is known as the PIT1 gene. This gene is actually present in the hypothalamus, which carries the PDR promoter, and it plays a very significant role in the development of the anterior hypophysis and also in the activation of the growth hormone and the prolactin gene. So again, both of these will actually affect in the long term with the whole process of how the organs are being developed of an individual and whole the cycles as well. Now, there is another role of the vitamin D in physiological functions. So we know that there are steroidal hormones like the progesterone, estradiol, histrone, the FSH. So these genes, in there also, vitamin D is having a physiological effect on them, and it is actually affecting the production of these hormones. So again, this proves that there is a very evident relationship, and it is being affected. Can we move to the next slide? Okay, so now here what we are discussing is the anti-Mullerian hormone. So it is a very good indicator of how long like a lady's reproductive tenure will be there. Like it is one of the biomarkers which are being extensively studied. Maybe in India we are not doing it that much, but in the Western countries already studies are there on its prominency and why it is being treated as a biomarker. And similarly, we have seen that when in winters, there is a decrease in the production of AMH, like the anti-Mullerian hormone, than the summers, and it is a very significant number. Around 18% there is a decrease, and this similar change is actually seen in the tenure of pregnancy as well. If we study the maybe how the AMH is being found, the AMH levels are changing during pregnancy. Similarly, in that way, due to the seasonal changes as well, it is changing. Now, in different animal experiments as well, we have seen that vitamin D has a prominent role in affecting both the male and the female reproductive functions. And there has been also a study which was studying the spermiogram test. The spermiogram test, actually it was found that the males who were having vitamin D levels were sufficient more than 20 nanograms per ml. For them, actually the levels of the spermiogram test had a much better result than the males who were having maybe lesser than 20 ng per ml. And the similar study was actually first shown in an animal model, and later it was repeated in a human model, and we could see similar results. So we can say it is a very good proof of this thing. Now, during the whole process of fertilization, starting from your capitalization, hyperactivation, and the chromosomal reaction, the presence or the sufficiency of vitamin D in the female body or the maternal vitamin D level is very important. Whenever it will be lesser, the chances of fertilization being successful reduces. Here, one thing I will like to, it can be a wrong message to everyone. So I would like to point out that the semen does not contain any levels of vitamin D. So here, when we talk about fertilization, we are only talking about the levels of vitamin D in the female body and not about any content of vitamin D in the semen, because it is not present there. Okay, so about in the last two slides, whatever we have discussed, we tried to point out on how important this particular vitamin, rather we can say a particular, it is because it acts more like a hormone, we can say it is so important. And that's a whole supplementation is something that is to be done from before one is even thinking about pregnancy, or even if a female is having any kind of reproductive related issues, they should be checking about their vitamin D levels. Can we move to the next slide? Okay, so now the whole time we were discussing about vitamin D, how it is affecting. So let's quickly we will be understanding a very little bit about the supplementation. Now, when I told you about pregnancy, so it is actually recommended that if someone is having if a pregnant lady is there, then the minimum amount of vitamin D that should be there, a sufficient amount, is 30 mg per ml, or it can be said to be 75 nanomolar per liter. And during the whole tenure of pregnancy, a normal level of vitamin D is something that has to be maintained. And in case it is not being maintained, of course, supplementation is something that is recommended, and it has to be there. So regular in during the tenure of pregnancy, regular checking of your serum vitamin D levels is something that's important. Now, by the Hungarian and the Central European guidelines, if we go by that, then 2000 IU of vitamin D supplementation can be given to a individual or to a female in the whole pregnancy journey, as well as during breastfeeding. So, and if we come to PCOD and PCOS, because while we were discussing, I had mentioned that pre-pregnancy, or maybe the starting of any infertility journey, would generally start with having multiple in the ovary, or having the symptoms of PCOD or PCOS. So in such patients, around 2000 to 4000 IU of vitamin D supplementation in general would be recommended. Of course, your clinical correlation is very important. Not getting into anything without consulting your physician is recommended. Whatever we are discussing is a general guideline. Now, according to the latest Central and the Eastern European bunches statements, it is said that the diagnosis of this vitamin D and the supplementation should actually be maintained before planning your pregnancy, then during the pregnancy period, then after the pregnancy, and also in the whole period of your breastfeeding as well. And of course, as we discussed, that the vitamin D3 levels are something that needs to be maintained from 30 to 50 mg per ml. That's the recommended thing, and also safe to say. So this is something that is there. Can we move to the next slide? So here, to conclude, I would say that whatever data we have discussed now, this actually proves the point that the vitamin D levels are very crucial to the fertility of be the females or the males. But it is actually the need of the hour that we do more and more clinical, human studies, as well as studies on animals, so that we can understand this relationship better. Whatever we are coming through are studies that have been actually in the Indian population, that studies are very less. So whatever we are discussing is more about the studies that was done in the European countries, or maybe the Western countries. So as a country which is more closer to equator, we are suffering, because we have discussed about the prevalence of vitamin D deficiency in our country. So of course, for us, there is a revolutionary concept actually which can change things, because we are a developing country, and for us a lot of money is getting involved, and it is getting through this thing. So this can actually change a lot of things if we do more research in the field. Can we move to the next slide? So these are some of my references. You can actually take a screenshot of this, and you can go through the studies. They are very extensive, and of course, this will help you to understand the whatever I spoke about. You can understand it in a much better way, because these are extensive studies. So you can always take a screenshot. That's it from my end. Thank you so much for the patient listening on a Sunday evening, and we are open to any questions right now. It was a short session, but I hope we did add some value to your evening.
Yes, definitely, Khushboo, I would like to take over from you. Very lovely session. We have got an intricate idea about the role and the effect of vitamin D in fertility. So, before going to the audience, I think they will also having many questions. But I would like to
Yes,
start a short panel discussion with our speaker. So first, I
Acha,
want
first,
to
Smita,
ask.
you just stop sharing the screen.
Yes, sure.
So, Khushboo, it is really a very crisp session, but it is lots and lots to learn. And not only for
Yes.
the female fertility, it is very, very important for the male fertility as well. And this is very important to understand, as you are saying that the couples are remains already very stressed for their infertility, or if they are planning for their kids. So the most important thing is for the IVF couples, very, very important.
Yes.
And even today Gargi ma'am has joined. The Gargi ma'am has a long term experience working with the gynecologist, so I do not know that how much importance is given by the gynecologist for testing vitamin D, but whenever they are shifted to the endocrinologist, it is my experience saying that vitamin D is one of the mandatory tests along with TSH and all the things. So it is very important. So it educate the people, because the name vitamin D, which is in the form of supplement or it is in the form of sunlight or diet or whatever, it comes in the area of a dietitians. So the dietitians can only educate the society about the importance of vitamin D. Even many children coming to my clinics are very much like deficiency in vitamin D. So what can happen? Even I will share one study that is published in the Journal of Clinical Endocrinology and Metabolism about the vitamin D supplementation on male infertility. So I will try to share it to Pritha, and Pritha will share to others. But
Definitely.
thanks to all. And now, Pritha, we are open for the discussion. Then we will come to the audience.
Yes, sir, sure. Starting with the first question to our speaker, Krishna. So, in your part, you have mentioned about the different roles of vitamin D elaborately. My question to you is, what is the like the frequency of testing our serum vitamin D levels in our body?
So, vitamin D level should be checked after every 6 months, like after every 6 months of interval. But if a person, if he or she is having a severe deficiency of vitamin D, then he or she should be introduced with the vitamin D supplement, and proper dietary modification should be done. Also, like if a person is having a deficiency, then after every 3 months, test should be done, and the test should be carried. The test should be carried forward till the level of vitamin D comes in a sufficient manner.
In a normal range that is highlighted by Kajal in her part.
Kajal has
Okay.
already highlighted, but people, what they do, they are not in regular in taking the supplementation whenever prescribed in 60K IU if it is prescribed. So weekly same time, if you are starting on Sunday, so if it is Sunday evening, you have to take on every Sunday evening for 8 Sundays, that is for 8 weeks. Then one tablet, if it is below 20 nanogram, then one capsule or one sachet once in a month for at least 1 year, then you go for the test again. So बहुत frequently टेस्ट करके फायदा नहीं है, लाइक ब्लड शुगर एंड ऐसे आप 2-3 महीने बाद टेस्ट करोगे, ऐसा नहीं. 6 month to 1 year you have to be in your regular blood test checkup. क्या करते हैं ना, विटामिन डी बहुत सारे ऐसे, इवन फॉर द इन्फेक्शन इन इम्यूनिटी, दो आई एम डाइवर्टिंग द टॉपिक, बट फॉर द कफ एंड कोल्ड इन्फेक्शन बहुत दिनों से ठीक नहीं हो रहा है, डॉक्टर एंटीबायोटिक दे रहा है. नाउ इट इज डॉक्टर आर इवन गिविंग विटामिन डी, that why the infection is not being cured. So the important thing is, so once at least you get it checked. पता नहीं, एक पेशेंट आया था मेरे पास, खुशबू 4 लेके आया था, ओनली 4 विटामिन डी. तो बाहर से तो देखने को नहीं लगेगा ना, आपको कुछ प्रॉब्लम नहीं लग रहा है, मगर उसको बहुत ज्यादा पेन है, सब कुछ प्रॉब्लम है, वेट भी ओवरवेट है. तो हो सकता है, मेरा अपना ही कजिन ब्रदर को हुआ था. सो ओनली एट द एज ऑफ 28, सो उठ नहीं पाता था, मतलब नीचे बैठता था, उठ नहीं पाता था, एंड इट वाज सीवियर पेन. सो ही वाज वर्किंग इन मुंबई इन ए कॉर्पोरेट, एंड जब एक दिन हुआ, बहुत सीवियर हुआ, डॉक्टर के पास गया मुंबई में, तो डॉक्टर बोला आप विटामिन डी करवाओ, एंड करवाने के बाद देखा जो 6 आया विटामिन. तो इमीडिएटली डॉक्टर सेड दैट नो, कैप्सूल एंड टैबलेट से तो नहीं होगा, आपका तो किसी भी तरह बोन फ्रैक्चर हो सकता है. सो देन द इंजेक्शन इज गिवन टू हिम. Now he is perfectly. So this awareness is very important, and I want to thank Khushbu that in a offbeat topic you have kept your discussion, not in a very regular topic. Even I have learned in this 20, 15 minutes, 20 minutes, I have learned many key points from Khushbu. And I am now very much keen to just Google surf and to learn more, Khushbu. It is very, the thing you have kept, Krishna, Khushbu, even the Kajal's part is very, very important for the clinical dietitians. Kajal's part is
Yes.
very important. And how
Because
Krishna
we
has
have to know the
set
ranges.
ranges and how Krishna has set the context, that is also very important. Now over to Pritha, 1 second.
Sir, I would like to say one thing here. जैसे आप बोल रहे थे, like you were saying, your cousin brother was having, my sister was having an issue, and she was she has a history of slip disc as well. She has gone through physiotherapy, and she's only 29. So 1 साल पहले का बात है. She's 30 now. She was 29, and she was having severe pain. Severe pain. She even had to leave her job because of severe pain. She was not being able to travel and everything. So she was sitting at home. I, being someone who has been studying vitamin D for a long period of time, I would tell her कि physiotherapist के पास जाओ, physiotherapist के पास जाओ, तुम बुद्धि हो गई हो. Even for once, I didn't think that her vitamin D levels can be this low, because I was like fooling around with her all the time. Then once she went to her physiotherapist, he's a family doctor, I worked with him. He just got a vitamin D test done. Then she was giving injections, and within a week's time, or maybe in 15 days, all her pain was gone. She's back to being normal. So this was that important, that for maybe 1 or 1.5 months she was doing this. She has to leave her job that she was doing maybe since 3 years. She got a promotion and she had to leave the job. Now this can be it can be this fatal if we are not being able to find out what the particular issue is.
And even as it is a fat soluble vitamin, whenever the people are starting supplement, we need to educate them about the dosage and not overdosing, and the continuation or the duration of the supplementation. Even I got a patient, I think last year only, we have discussed this case study also. The patient is having hypervitaminosis. So vitamin D is above 100. So this can also happen, and this can be very much fatal. So
Sir,
that is important.
even I came across a patient last week. She came to us, our setup right now. So she came to us and we did her PMD test. We have a PMD test setup. Did that for her, and her PMD levels were normal. So we were discussing this with her. She told me that 6 months ago, she had very low levels of vitamin D. Maybe it was around 15 or so. So the doctor suggested her to take injections. She took maybe 3 injections, and then toxicity happened. She was having another issues. It went to 120. So even the wrong supplementation, or maybe wrong kind of injections, or maybe when the dosage will be more in the injections, it is not being calculated well. Again, it can be a very big issue for the patient. So being very skeptical and connecting with the physicians before taking supplementation is something that's very important.
Khushbu, do you have to say anything? Even I have find many prescriptions 1K IU or lesser dose every day, or it will be good for weekly dose of 60K IU.
Sir, here I would like to add that the 60K IU ones are generally given to people who are already having a lower level of, vitamin D levels. But for the ones who are having normal levels of vitamin D, but then the sun exposure is not there, number one. Number two can be their diet is not actually supplementing them in vitamin D. We already know that in diet, vitamin D supplementation to hota hi bahut kam hai. On top of that, because of the corporate lifestyle and everything, we have no sun exposure as well. In those cases, around 200 IU or maybe 1900 IU regular supplementation can be used for a term of 3 months. Then they can stop it for a while. If possible, they can get tested and then continue it for maybe again 3 months. That is something that is actually recommended.
But not about the daily dose of vitamin D.
I said daily dose of 1900 to 2000.
1900 to 2000. Even in your product also, there are very good products. Even my cousins and many of them
And
have
nutraceuticals companies are having a lot of
companies are lot of vitamin Ds also. So that are very good, very good. Even you can see the calcium supplementations are also fortified with vitamin D.
Yes.
Minimum dose of vitamin D are there. All the
generally
calcium.
500 IU or 1000 IU.
500, 4 to 5. Okay, Preetham, move on to the next question. And we have some question in the chat box also.
Yes, yes, definitely. So we have to create the awareness. So my question is to Khushbudi, that you have in your part you have highlighted about the PCOS and PCOD cases. So what is the like vitamin D supplementation in this kind of
Very
patients we
important
can give,
question.
and what is the role that vitamin D plays in this type of patients? Can you just highlight?
Okay. So when we were discussing about the fertility issues, I twice I think I mentioned about the PCOD and PCOS patients, because that is the starting. And nowadays, what we in our practice as well, we see that these patients are the ones who are generally coming with metabolic disorders. So once we get a patient, generally they will come up to us with a vitamin D test done, because they generally come after visiting their endocrinologist, or maybe their gynecologist. Once they visit, they'll come with a vitamin D test in general. So supplementation as well, whenever I have generally seen, if in general, if you are having 10 patients with PCOD, at least 9 are going to have low vitamin D levels. It will be lesser than 20 mg per ml. So generally, the doctor only suggests them to have 60 KIU supplementation. In general, that is what is done. If it goes even below 10, then of course injections are something. The vitamin D supplementation through injectables are something that's recommended by the doctors itself. So in those cases, if the test is not done and you are being able to see the PCOD and PCOS symptoms, it has not been diagnosed by the doctor, and the patient has first come to you with maybe obesity, or maybe having any kind of hair fall issues, or maybe skin issues. With all this, also people are first coming to the dietitians. In those cases, as a healthcare provider and as a dietitian, it is our goal to tell them to get a vitamin D tested along with a vitamin B12 level, both getting tested. And when supplementation is needed, we need to recommend them the supplementation as well. And in these cases, it is important to have a good consultation with the physician as well. Both the dietitian and the physician should be coming together, and then we should recommend, because it is going to affect the whole metabolism of the particular patient. So in these cases, being very skeptical, being smart, and using a knowledge are two things. So both have to go hand in hand when we are dealing with these patients. And supplementation of vitamin D is important, but then supplementation of the micronutrients, be it zinc, be it selenium, are things that needs to be discussed with the patients, and we have to aware them about these micronutrients as well, along with vitamins.
Definitely. And to you, another questions I have, like males also face infertility, you have mentioned in your part. So for males, what would be the thumb rule to maintain the fertility when he is in the good condition?
Okay. So for males actually, or in general as well, I can say that some of the major issues that we are facing right now are that the lifestyle that we are leading. The four pillars are something that we are not abiding to. When I talk about four pillars, we are talking about our diet, of course, the nutrition, then our exercise, the mental health, and doing some or the other kind of like exercise on a daily basis, managing your stress levels. So four pillars include your nutrition, your like meditating or managing your stress levels on daily basis, your um, exercising on a daily basis. Now these things are something that has to be managed by all of us. And for males as well, they are not being able to manage their stress levels. For that, they have to do some or the other kind of stress releasing techniques, be it deep breathing, be it going for meditation. Start from 5 minutes a day, that it takes nothing. When we talk about exercise, it is not like you have to join a gym, or you have to go to a certain class and then you have to exercise. Even plain and simple walking for 30 minutes a day, being active for at least 150 minutes a week, is something that's very important for the males. Third thing, and one of the most important things, is generally what we see in, at least in the urban setups, is the use of alcohol and the use of smoke, like, and the men smoking is something that's extensively there. Now smoking, as we know, actually like results into lowering the sperm counts along with whatever lifestyle, sedentary lifestyle we are leading. So you are actually triggering your infertility. You are calling your infertility by going into extensive drinking and extensive smoking. So that is something that they have to manage. Now this will go, generally people, what they counter is that they are having a lot of stress, and because of that maybe they are smoking because they have this pseudo thought that smoke करने से stress कम हो जाएगा, but it is not the thing. It does not help. So managing your stress by different other techniques, and rather reducing the consumption of any alcoholic beverages on regular basis, and smoking, reducing that as well, can be the thumb rules that can help the males to reduce the infertility levels, whatever we are seeing right now, and abiding to our biological clock. One very important thing is abiding to our biological clock, trying to sleep on time, wake up on time, going for meals that are in the timing of the biological clock. We understand that as dietitians, we can say a person has to have their dinner by 8. That's not possible. But आप जितने बजे भी अभी खा रहे हो, maybe you are having your dinner by 11. Try and reduce it to bring it by at least 1 hour earlier to whatever you're doing right now. So even the small changes will actually lead to very big results in future. So these will be the thumbs that I would like to share.
And this will be, and there our role will be very much crucial to educate the patients about that. My last question is to Kajal, since we are talking all about vitamin D and the sources. So we know sunlight is one of the natural sources of vitamin D, the best sources. So what is the time period which is like best suited for taking this UVB radiations? Can you just highlight?
Okay. As we know, sun rays is very important for synthesis of vitamin D. Mainly UVB rays are very important. So the midday time is very important because the proportion of UVB rays is very high in this time. So the midday time is very good than the early morning and the afternoon time, evening time. Basically 11 a.m. to 3 p.m. is the good
11 a.m.
time.
to 3 p.m. Okay, because that we have to know what is the time period, since we are all talking about the exposure. So yes, that's all from my side. Thank you for the panel discussion. Now we can move to the audience. If they have any questions, we can take that. Jyoti ma'am also shared some insights. Yes, Khushbudi.
Sir, I would like to ask sir that actually last Saturday I went to my mother's clinician, and he actually mentioned na ki apni সকাল সকাল যখন রোদ্দুর বেরোয় তখন রোদ্দুরে যাবেন, তখন তো স্ল্যান্টিং রেজ আছে, উনি বলছেন স্ল্যান্টিং রেজ আসে তো আপনার রোদ্দুরটা একটু ভালো করে গায়ে লাগবে, আপনার ভিটামিন ডি লেভেলটা শুট হবে, তো আপনি এইভাবে করবেন। Now still even people are not being able to understand about the right time when we should be going, and this was coming from someone who is an MD. So at those times
how
I
come
actually,
it can happen, Khusboo?
yes, that only is something that I am still understanding. And he is a knowledgeable doctor. He has been with us for more than 2 years. He's managing her well, and this is what he was explaining.
You have not interrupted?
Yes sir, I did.
Okay.
I was not disrespectful to him, so that is what I want to convey to everyone as well. Maybe we are juniors to all these doctors, and maybe people who are holding a position, but I during a session actually got to hear this from a very senior dietitian, that we are not supposed to listen to whatever people are saying when the knowledge is not being imparted in the right way. So if you know the right thing and they are not updated enough to know whatever is going on in the research industry, we should very respectfully, we should respect whatever they are saying, but we should respectfully also convey that this is what I have studied, this is so and so place from where I have studied, so you can just correlate with it. And if I am wrong, you correct me. If I am right, then of course you can take it from me.
Definitely.
True. Great.
So in
Great.
the chat box, sir, Jyoti ma'am have shared her views also regarding PCOS and about the role of vitamin D. So we can take some questions. You can just unmute and ask. If anyone is
Anisha,
having any
you
question.
have a question?
I have a question. Yes, sir. Sir, first of all, thank you so much
Anisha ji, yes,
for
you
such
are
a
there.
informative session.
We take Anish from Madam Anisha Majumdar also, but Anisha Shukul is also there. Anisha ji, you please ask, then we will take from Anisha Shukul. We
হ্যালো
have two.
স্যার আমি একটা
Acha, no, one minute. First, let her complete, then you will. Anisha, উনি বলে নিক তারপরে,
My
হ্যাঁ।
question, sir. My question is just now, as you said that the sun exposure should be from 11 to 3. Now, there's a chance of getting a sunburn also. So I want to know
UV.
how can we differentiate?
Yes, that
How
is
can we say that it's
very
the
important. That is very important thing you have asked. So we are requesting not to go to the sun for a long time body. This
right
portion,
amount?
our face to neck and our feet is enough to get the sunlight there. And if we can walk 20 minutes, that is, if your bank is nearby and you are going walking 500 like meter to the bank also, and then again coming back, so that can also do. It is not that you have to go with a 50 SPF sun, that is sunscreen. So that will not do. अगर बहुत ज़्यादा SPF वाला सनस्क्रीन यूज करेंगे एंड बहुत ज़्यादा मोटा अम्ब्रेला यूज करके जाएंगे तो फायदा नहीं है। ऐसा नहीं है जो सन बर्न होने के लिए बोल रहे, मगर थोड़ा बहुत सन में तो जाना जरूरी है। इवन फॉर द वेस्टर्न कंट्रीज दे डू सन बर्थ, बिकॉज सन निकलते ही नहीं है वहां पे, तो सन बात करना पड़ता है। तो इट इज द टाइम इज नॉट लॉन्ग, 11 to 3 p.m. total time is not there. We have to just give, I think, Khushboo, if I am not wrong, 20 minutes, 30 minutes, or what Shomom has discussed. I have forgot. That was on the based on the current study.
Yes. So actually, sir, what you said is completely true. That going in the sun for long hours is not suggested, because that will burn us, because we are more closer to the equator. But what we have to do is we have to go in the sun for shorter periods of time, and tanning to hoga hi. Like tanning we are going to have. Now for people who are having skin allergies by the UVB radiations, they have to be a little more like we have to understand our whole body, and we have to be understanding our tolerance levels as well. It will never happen that a person is going in the sun for maybe 5 to 10 minutes, and in that period of time only they are going to get sunburn.
Obviously,
So,
those who have more melanin,
yes,
complexion will be little bit darker, so they will take more of the sunlight than people with that less melanin. So
also
melatonin.
we have a very good answer from our Somadi. She has mentioned that 30 minutes in winters and 15 minutes in summers is something that is suggested for our side of the country, because we have a good balance of summers and winters.
True.
Thank you, Somadi.
Thank you. Thanks
Thank
a
you.
lot, Shoma. Thank you, Anisha ji. Over to Anisha Shukul.
হ্যাঁ স্যার, আমি যেটা বলছিলাম যে টিএসএইচ হরমোন সেটা কি কোনোভাবে রিলেটেড এখানে? কারণ যেহেতু আমাদের যে ফ্যাট মেটাবলিজমটা অনেকটাই ডিপেন্ড করে হচ্ছে টিএসএইচ হরমোনের উপরে, আর যেহেতু ভিটামিন ডি হচ্ছে একটা ফ্যাট সিনথেসাইজড হরমোন, সিনথেসাইজড ভিটামিন, এবং আমাদের যে গোনাড হরমোন গুলো সেগুলো হচ্ছে গিয়ে মেইনলি কোলেস্টেরল থেকেই সিনথেসিস হয়। ব্যাস।
Yes, so একদম তুমি ঠিক কানেক্ট করেছো জিনিসটাকে। So because our TSH levels are also affecting our like whole of our metabolism, and we already discussed that how our hypothalamus is being involved, because BDRs are present there as well. So of course TSH का जो levels है, they are being affected by our vitamin D levels, because the whole
Not only vitamin D, Anisha is very much right, and Khushboo, even it is the relation of the calcium also. So
Yes,
calcium
definitely.
level and vitamin D both are significantly associated with the degree and the severity of hypothyroidism.
yes.
So it is nice question, Anisha, and someday you can also explain, because you have this concept. Thank you, Anisha.
Very thoughtfully framed question. Thank you so
Yeah.
much.
Thank you, Anisha. We can
থ্যাংক ইউ
discuss
স্যার।
this.
আর আরেকটা স্যার জিনিস শেয়ার করব, মানে এই রিলেটেড।
হ্যাঁ, নিশ্চয়ই, প্লিজ।
সেটা হচ্ছে স্যার, আমার যখন প্রেগনেন্সির সময়টায়, মানে 2017 সালের কথা বলছি, তো আমার ভিটামিন D3 ডাক্তারবাবু টেস্ট করিয়েছিলেন, তো আমার মাত্র 13 ছিল। সিভিয়ার মানে প্রবলেম ছিল। তো উনি কিন্তু আমাকে মানে সান এক্সপোজারে থাকতে বলেছিলেন, স্পেসিফিক্যালি পিঠের অংশটা যেন রোদ লাগে এরকম বলেছিলেন। এবং উনি বলেছিলেন, আমি তখন বলেছিলাম পুড়ে যাবে, তো বলছে হ্যাঁ পুড়ে যাবে, যেন লাল লাল স্পট হয়ে যায়। মানে তিনি গাইনোকোলজিস্ট ছিলেন, মানে তিনি আমাকে এরকম ওষুধ দিয়েছিলেন, আমার মনে নেই, তবে সেই ওষুধটা কিন্তু মানে কি বলে নন ভেজ মার্কিং ছিল, মানে মেরুন কালারের যে ডটটা ওরকম আর কি মার্কিং ছিল ওই ওষুধটাতে। তাতে মানে কিছু কোরাল থেকে সিনথেসিস করা ওষুধ ছিল, ক্যালসিয়াম প্লাস ভিটামিন ডি ডেলি দিয়েছিলেন। এবং মানে উনি আমাকে এরকম ইয়ে করেছিলেন, এবং আমার পিঠ কাটা জামা ইউজ করতে বলেছিলেন ডিউরিং সানবাথ।
সানবাথ, ওকে।
Sir, এই সেম ওখান থেকে আসছে যখন সোমম was discussing in his session that the pinkish tint আসবে when you are in the sunlight with the minimum clothing, and when the pinkish tint will appear on the body, that means that in the whole day if you are there in the sun for more than like 24 hours at a stretch with minimum clothing, তখন বলা যায় যে जितना वो pinkish tone आता है minimal erythema, again Somadhi remembers the term as well, so minimal erythema is the thing, and ওখান থেকে actually 60 IU বলেছিল that that much of sun is that much of vitamin D is being synthesized in our body, that much of supplementation will actually occur. So this is the same thing the doctor actually told her, it comes with the same concept.
And I wasn't hypothyroid. I didn't have hypothyroidism at that time. Till now I don't have, but I'm just connecting that.
Yes, of course we understood that you are not having hypothyroid.
Supriti and Purna, just be fast on asking the question.
Actually, sir, I don't have any question. I just wanted to share one case.
Please share.
It's my case only. So when I moved to Vellore, my vitamin D level was 3. It is very critical stage for me. And as I just first in hostel life, so I can't manage everything very well. So most often I forget to take that supplement. So one thing I did that I stopped using the sunscreen and I stopped using that hand cover for removing the tan and all. So within 5 months, my vitamin D came from 3 to 17. It's not in like correct parameter, but it increased the vitamin D.
Increased, at least increased.
Yeah.
Okay.
So sometimes we need to ask our patient also about this, all the other peripheral things. That thing only I need to share. I want to share.
Thank you for sharing.
Okay. So, and then after Supriti, Purna Ghosh.
হ্যাঁ, আমার একটা কথা আমি জিজ্ঞাসা করা আছে যে ভিটামিন ডি আমাদের সান এক্সপোজারটা খুব দরকার হয়, কিন্তু যারা একটুখানি কভার্ড ক্লোথ পরে যেসব কমিউনিটি গুলোতে, যেমন ইসলামিক কমিউনিটি, তো তাদেরকে কাছে চ্যালেঞ্জটা কি করে মানে আমরা করবো আর কি, যে তারা তো এখন কভার্ড ক্লোথ পরে,
Whenever they are at home, they can at least do that. According to the custom, when they are outside, they will not be able to expose. Yes, obviously there is vitamin D deficiencies. It is a challenge, really.
আর এসপিএফ এর ব্যাপারটাতে বলি, সানস্ক্রিন আমরা সবাই এখন এই ট্যানের ভয়তে, গরমকাল আসছে সবাই এসপিএফ লাগাই।
আমরা একটা শেয়ার করব তোমাদেরকে ভিডিও, সেটাতে একদম ডিটেইলস বলা থাকবে এসপিএফ। Soma, do you want to say anything about the SPF?
Yes, we would like to hear it from Somadhi.
Yes, sir. First of all, good evening to all. It was a wonderful session, very informative session. Sir, I just want to share that about SPF.
That is the sun protection factor.
Yes, that is our sun protection factor. If you are using SPF 15, that is also not doing any vitamin synthesis in your body. So if nowadays there is so many SPF like 50, 60, so that is not going to synthesis vitamin D. and it is starting from just SPF 15. So if you are
Mane
want to
15 is also not recommended, Shoma, and
no sir,
above 15 তো obviously is not recommended, মানে 15 নিলেও ভিটামিন ডি সিনথেসাইজ হবে না, তাই বলছো তো?
হ্যাঁ স্যার, হ্যাঁ স্যার।
ওকে।
অ্যান্ড ইফ যদি কেউ ভিটামিন মানে এসপিএফ লাগাতে চায়, তাহলে বলা হয় যেমন আমরা শিখেছি সৌমমের থেকে, কগনাইজ নিউট্রিশন থেকে, যে মুখে লাগাও, হাতটাকে ছেড়ে দাও, পিঠটাকে
Yes.
ছেড়ে দাও। হ্যাঁ, আমাদের বডির যে মানে 1/5 পার্ট আছে, সেই 1/5 পার্টে রোদ লাগলেই হবে, এমন নয় যে
1/5
আমাদের সারা
part can
বডিতে
be
লাগাতে
exposed
হবে।
to sunlight. Okay.
হ্যাঁ, 1/5 পার্ট ইজ এনাফ ফর এক্সপোজ টু সানলাইট। তো মুখে এসপিএফ লাগাতে পারো, বাট তোমার হাত, ঘাড়, পিঠ এইগুলোকে ছেড়ে দাও। তো সেখানে একটু ট্যান, আর ট্যান যতক্ষণ না আসবে ততক্ষণ কিন্তু ভিটামিন ডি সিনথেসিস হয় না, যেটাকে বলা হচ্ছে অ্যারিথমা, মিনিমাল অ্যারিথমা। তো ট্যানটা আসা মানে সেখানে ভিটামিন ডি সিনথেসিস হচ্ছে। হ্যাঁ,
যেটা
তো
আমাদের অলরেডি সুপ্রীতি বোধহয় শেয়ার করলো তার লাইভ এক্সপিরিয়েন্সটা,
হ্যাঁ
and আমাদের অন্বেষাও ইউজ করলো, এই শেয়ার করলো অন্বেষা শুকুল। হ্যাঁ, থ্যাংক ইউ সোমা ফর জাস্ট অ্যাডিং দিস।
স্যার থ্যাঙ্কস টু ইউ, আপনার জন্যই আমরা এগুলো জানতে পেরেছি।
No, মানে it is exchange of knowledge. We have Khushboo, we have Krishna, we have students like you. So this is the example to our new batch 6 students that they are also our student. Soma, Pritha, Khushboo, Krishna, and you are also students. So Anesha has also added a very good thing. So I want to say that we are all student at any point. Even I am student, so I am learning at any point. So the important thing is how much you want to explore yourself, that is up to you. কতটা নিজে জানতে চাও সেটা রোজ তার জন্য পড়াশোনা করে যাও। 10 মিনিটও করলে, অনেকেই বলে বাইরে আছি, অবভিয়াসলি আমি ডিস্টার্ব করি না যে ক্লাস অ্যাটেন্ড করা ইজ নট পসিবল, বাট হ্যাঁ, you can request Pritha or me for the new videos. Even Pritha, you will agree with me, today's class is another exceptional class, carbohydrate counting. Though there are
Yes,
many
sir.
things same, there are many things same, but ma'am has totally changed the module. So joto bar and
Also, she have added many new things in this
many new things,
batch.
carbohydrate counting, pediatric calculations. So whenever Khushboo, cognized nutrition is not a one-time course. 6 months you are paying, and you are going to explore for lifetime whenever you require us. So
Sir, whenever I'm having a discussion with Devjani, I don't know if she's there or not. Amara Devjani,
no, she's
we always tell one thing, that when we were doing the course, at that point of time also, just attending the class, in the class we don't always understand everything that is being taught, but when we are watching the video maybe once or twice or maybe thrice, and we are jotting out the points, actually we are coming across a lot of new things, and then we understand that kuch na kuch class mein chhoot gaya hai. So that is why I would say the recordings that we are being provided is even more important. When we were having our discussion classes, or you would tell us ki is topic pe discussion class lena hai, and before that we actually had to give, for maybe that day when the class was done, it was for 1 hour, 1.5 hours, but when we are studying it, that same 1.5 hour class, like being able to, for making us like making ourselves understand ki hum log kisi ko padha sake, it used to take us more than 3 to 4 hours.
Definitely. I truly agree with Khushboo in this part. Now, when we are taking in batch 6, definitely I want to share this thing, because the diet chart part of the NCP modules that SAR have been taken in batch 6, that really took me 2 days to go through each and everything, to note it down, because I felt like you have to teach someone that they may have many queries, but when I am just watching the recording and doing it on myself, it took me a lot of time to see the whole topic and make understand once more, because I have already
agree with Krishna. I agree with Khushboo that whatever the things, I am also giving some lectures to some scientific sessions, जहाँ पे भी लेक्चर देते ना, एक्चुअली कुछ ना कुछ वीडियोस देख के हम सीखते हैं। बहुत ज्यादा स्टडीज, जर्नल्स एंड ये सब। एक मिनट जस्ट एक सेकेंड। Acha. So, so that is, I usually used to learn Khushbu from the different doctors or scientists videos, how they are explaining the things, how they are doing the things. More and more you will watch, more and more you will learn. In our time, only option is books. No other things is there. So, and our teachers, obviously our teachers. But now, as this offline, COVID has given this online platform to us. Before leaving, Shobhik sir has also joined. I'm really
Yes.
privileged that he has taken his time and he has joined our platform. Thank you so much, Shobhik sir. If you want to say anything, you can say. And even Krishna, how many times I have rejected you for this course? Because the according to my course curriculum, your degree was not matching. So that's why I was rejecting. And only the urge and the love for this dietetics and nutrition. And when he told us about his background, that he always want to be a dietitian and his father's wish and everything. So I was bound to take him, and he is now our family member. So that is very
And sir,
important.
the amount of effort he puts, that's
Yes,
just commendable.
commendable Krishna. Thank you. I think Krishna is not there. He has
He's
left.
there, sir. He's there.
No,
Okay.
no, sir.
He's
I'm
there.
there,
That's
sir,
fine.
and I'm listening, sir.
Okay. Okay. Thank you.
But I'm always thankful for you and this platform because I would not defame anyone, but this platform has taught me such a great things like which I have not came to know from any other platforms. Like, and I always wanted to be a
One thing
dietitian, and
I
the
want to
proper
interrupt.
core knowledge I get from this platform only,
Apart
sir.
from knowledge, code knowledge, leave it aside. It will teach you the family bonding. It will teach you how to
Absolutely.
help each other.
Absolutely.
It will teach you how to stand beside when you are in crisis, when you are in happy. Even we have a very माने what माने जितना भी तारीफ करे कम होगा फातिमा. तो शी इज देयर एवरी टाइम, लोगों के हेल्प करने के लिए शी इज देयर. तो ये
वेरी
होना
ट्रू
चाहिए.
सर. एंड मैंने भी ये प्लेटफॉर्म तभी ज्वाइन किया था जब मैं अपने कुछ पर्सनल क्राइसिस में था जो मैंने आपके साथ शेयर
आई नो.
किया था सर. एंड ये प्लेटफॉर्म ने मेरी उस जर्नी को और इजी बनाया था. मैं अगर ये बोलूँगा कि मेरी जर्नी इस प्लेटफॉर्म की वजह से काफ़ी इजी हो गई थी. सो मैं ये प्लेटफॉर्म के लिए तो हमेशा ग्रेटफुल रहूंगा. लाइक मेरे लिए तो हमेशा मतलब सबसे पहला अगर कोई मेरा सब प्लेटफॉर्म रहेगा तो मैं बोलूँगा कॉग्नाइज न्यूट्रिशन, बिकॉज ये प्लेटफॉर्म मेरी लाइफ की एक बहुत इंपॉर्टेंट जर्नी यहाँ से शुरू हुई है. और आई गेस ये मैं इस प्लेटफॉर्म के साथ तो मैं लाइफ लॉन्ग कनेक्टेड रहना चाहूंगा.
True. As long as you want, you can stay
This
connected.
platform is for lifetime only.
Same thing I want to say about Pritha also. So they have completed their course long before Fatma Pritha, but down they are becoming very much important part of this platform. Thank you all. Thank you those who have joined from our platform or from other platform. So thanks a lot. So we need to wind up, and Pritha, I will request you to just wind up the session.
Yes, so giving a heartful of thanks to all the speakers for their contribution, to all the audience for the patient listening, and last but not least, our sir for supporting us in this way and being beside us the same way from day one. Thank you all, and good night.
Good night.
Thank you.
Thank you, sir.